Senior Clinical Lecturer at the University of Exeter Medical School. Good afternoon, Doctor.
Hello, good afternoon, everyone. Good afternoon.
Good afternoon. So, a lot to talk about there after the Prime Minister's address to the nation. Of course, all of this was meant to happen a month ago. It was delayed, largely to get more people vaccinated and to look at their impact on that. Do you think now is the right time?
It looks as good as it can be. Of course, I, as a infectious disease expert, would say, whilst you are removing restrictions, I think you need to get your messaging more precise. And the messaging more precise is you need to emphasize, and Prime Minister Johnson mentioned it, but you need to emphasize. In his opening words, he said, it is far from over by the 19th of July. And we need to keep on emphasizing that it is not over just because we're removing restrictions. We need to continue with infection control measures.
Now, the 5-point plan, which I mentioned a couple of minutes ago, can we just go through that and just get your thoughts on the points? So, Boris Johnson mentioned 12 weeks down to 8 weeks between jabs for under 40s and booster jabs. Is that possible?
Yes, it's possible, and that's a good thing to do. We were frantically trying to immunize as many as possible, as fast as possible, by widening the gap between the first and the second dose. But now that we've got better vaccine supplies, it makes ample sense to shorten that interval between the first and the second jab. And remember, it is the fully immunized, meaning 2 jabs, that gives you maximum protection.
Point number 2 from the Prime Minister: no legal restrictions, indoor and outdoor gatherings, care home visits, sports events, etc. Also, the N2, the 1 metre plus rule, and return to the workspace, and no COVID passports to business or events. Your thoughts on those?
So I expect, as a result of removing that restriction, case numbers will go up. And my advice would be that if you are vulnerable, you are in a sensitive category like poor immune system, etc., please, of your own volition, please do wear a mask, and wear a good quality mask, and wear it properly. Because whilst it may be, I don't have to, your personal protection is important, and you may want to do that.
With that point there about the end to the 1 metre rule plus, would you rather that stayed in place?
For the time being, especially in crowded situations, you need to be a little bit cautious. So poorly ventilated indoor places and no social distancing are at risk places, without a doubt. So we need to have either mitigation or we need to have protection. We need to do something, because you can't just say, on the one hand, Prime Minister Johnson said it's far from over. Well, considering it's far from over, why are you allowing people to mingle closer to each other in an indoor setting?
And also, we're going to hear from the Education Secretary tomorrow for his plans to remove bubbles from schools. The infection rates in schools, are they going up or are they going down?
Oh, they're going up, and it is a headache. So in the schools that I am dealing with, it really is very, very disruptive. And in some places, my place, one of them, we have about 50% of the pupils off school at the moment. That is a lot. And it's very disruptive. We need to sort out schools. And the way to do the schools is no mention by Prime Minister Johnson today of immunizing the younger age groups. I think we need to consider this, especially as these are not banana republics: United States, Canada, Israel, Netherlands. They know what they're doing. They're doing the scientific way of immunizing younger age group, and the UK is an outlier on this matter. We need to address this, and we need to address ventilation in schools so that schools continue to operate normally without the disruptions.
Also, point number 4 from the Prime Minister this evening: to work with the travel industry to stop quarantine from amber countries. Apparently, we're going to get an update on this later this week. If we stop the quarantine from amber countries, does that mean we're going to get more infections coming into the country?
Oh, yes, of course. The good thing, of course, is that if you are fully immunized and you pick up an infection, you are less infectious to others. But if you are not immunized and you have been to an amber country or a red listed country, or been in a crowded place, etc., whilst abroad, you can pick up infections and you will introduce it back home. So look at the example of red listed India. There were so many infections in India when the people rushed back to beat the deadline of India going on the red list. And as a result, we had to postpone the June reopening of the United Kingdom. So yes, amber countries, returnees will reintroduce infections unless we are careful and cautious.
And the fifth point was to continue to monitor the data, to do everything possible to avoid reinforcing restrictions. Doctor, just finally, is it inevitable that COVID cases will go up over the summer months?
The summer months is a gift in that we're mostly outdoors, we're not mingling in indoor settings, etc. So they may not go because schools will have broken up, and it is the schools which lead to the rise in cases, and then the other ages pick it up. What is interesting will be what happens come September. And my view would be between July and September, schools ought to invest in what we would call air purifiers, HEPA filters, carbon dioxide monitors, and increased ventilation. And if they did that, the schools will operate in a safer way come the new year. And I emphasize again, we need to address the issue of not immunizing children in the younger age groups.
Doctor, thank you very much for your chat this afternoon. That is Dr. Bharat Pankahania, who is a senior clinical lecturer at the University of Exeter, the medical